Hi, my name is Dr. Sandhya. I am MDS Prosthodontics and I'm practicing dentistry since last 10 years. Gum diseases basically are the diseases which occur in your gums. Gums are the soft tissues in your which hold your teeth. So gum diseases actually start if you don't take care of your oral hygiene properly. So there can be bleeding from the gums, there can be tooth loosening, there can be different symptoms of these gum diseases. And mainly the gingivitis, periodontitis are the gum diseases which are more prevalent in our society. Basically, if you're not following a very good oral hygiene, you can have gum diseases. The main symptoms which come up are you get redness in the gums, there is soreness, when you're brushing there is bleeding from the gums. So these are the initial symptoms that you will come across when you have gum diseases. And this can, if this is left untreated, this can lead to loss of the bone which is surrounding the tooth, and in the last your tooth can get loosened. So these are the symptoms that you will have to look for. Gum diseases, they can start at any age, and basically at teenage and people in 20 and 30s, and then you see people in 40s and 50s mostly getting affected with periodontitis, which is loosening of the teeth. So so if you're ignoring the initial symptoms of gum diseases, that is redness, the bleeding of the gums and all, what happens is that inflammation and the bacteria, they keep affecting the bone which is surrounding your tooth structure, and eventually what happens is that tooth structure, that tooth is like the cementation of the tooth becomes loosened, and you start feeling that your tooth has become mobile. Cavity or dental caries, that is the most prevalent disease and the most common global disease which occurs in dentistry. And basically, if you're not maintaining your oral hygiene, what is happening is you have a very deep pit and fissures which are naturally present in your teeth. So the bacteria, they go and harbor and they start demineralizing the tooth structure over there, and hence they reach the deeper layers of your tooth structure where you have your the nerves and the blood supply and the nerve supply is present. So you start getting that cold and hot sensation once the upper layer, that is the enamel, which is supposed to be the strongest layer of the tooth, gets affected. And that causes sensitivity to obviously hot and cold, and obviously sensitivity to sweet food is also one of the symptoms which is coming. The bad breath basically is caused by not maintaining the oral hygiene, if you're not brushing properly, if you're not taking care of your diet properly. And bad breath can be prevented if you do your toothbrushing, if you normally do your flossing regularly once or twice a day, and if you're taking care of using mouthwash and all, which are readily available in any of the chemist shop. Okay, so whatever kind of toothbrush you're using, it should be replaced within 3 to 4 months. So because some people start using a toothbrush, they apply too much of pressure and they keep using it until unless the bristles wear off. So you should not wait till the time the bristles are wearing off, and you can always replace a toothbrush within 3 months. So the best way to cure gum diseases is that one is that you have to regularly go for your checkups with your dentist. Within 6 months at least, you should go for your regular dental cleaning and polishing, and also you should be following the home regimen that the doctor is advising you, and that includes toothbrushing twice daily, once flossing, at least before sleeping you should floss once daily. And obviously in case if the doctor tells you that you have malaligned teeth, or you are more predisposed to having plaque and all, then you can always go for brushing after each meals. In case you are having any kind of systemic disease or something else, then obviously your dentist would advise you how you can maintain your regular oral hygiene at home. And also, time to time you can use your medicated mouthwash which have antiseptics. And so the basic thing is regular dental checkups and visits to your dentist is going to prevent your gum diseases.